So thank you, Brian. We wouldn't be here were it not for Brian's initiative. He's the one who ran with the football after Vice President of Kaiser Baxter came up with the idea of convening experts from around the country to share their expertise on this important issue. So thank you, Brian. As a matter of sort of setting the ground rules in terms of the lingua franca, I feel it necessary to talk about what we mean by sugar. So there are a variety of definitions of sugar, and for more detail, you can always go to the references given at the bottom of the slides. I have a number of slides that will discuss each of these bullets. For this particular slide, I want you to focus for a minute on the fourth bullet, the percent of total energy intake from added free sugars. This is the metric most commonly used by health organizations, by the World Health Organization, for instance, the American Heart Association, for communicating to the public what is too much added sugar. And so this is something to keep in mind. There are other ways of evaluating the magnitude of sugar intake. I know in the early days in California with school nutrition, the focus was on the weight of the sugar in the food, and at that time they didn't distinguish between added sugars and total sugars. So as you may recall, the SB 19 standard was that foods that had more than 35% by weight sugar in the food was no longer acceptable on public school campuses in California. Most of the time we'll be talking, when we talk about sugar, we'll be talking about monosaccharides, glucose, fructose, galactose, and disaccharides, such as sucrose, maltose, and corn sweetener. Now, free sugars, that's to some people a new distinction, and I'll talk about added sugar in a minute, but there are concerns with fruit juice. Fruit juice is not added sugar, but it's considered an important source of excess sugar, in part because in the course of processing, fiber has been removed. And one of the exciting themes in the emerging science of the gut microbiome is the importance of the fiber that's removed from foods during processing. And I think that the science of studying added sugars is going to be enriched by the insights that are right now mostly limited to animal studies looking at the gut microbiome in mice. But I predict very confidently in the near future there will be an increasing amount of research done on humans with respect to the importance of polysaccharides and oligosaccharides. I want you to look at this slide for a minute and look at these two objects. On one side, 8 ounces of apple juice, and on the other, an equivalent amount of apple. And compositionally, they're fairly similar in terms of water, fairly similar in terms of sugar, but a huge difference in terms of the fiber content. And that may have implications, it turns out, for satiety signaling. One of the emerging lessons learned from the mice studies of the gut microbiome is that these soluble polysaccharides generate fatty acids, short-chain fatty acids, which then trigger satiety signals in the form of a couple of hormones. So as we saw in tobacco control, the more you study the phenomenon, the more complicated it gets. And you know, for us researchers, that's wonderful job security. So here we are with added sugars. Basically, it's whenever you add sugar to a product that didn't intrinsically have that sugar before you added it. And there are a variety of names that consumers encounter when looking at the ingredient list of products for whether there's sugar in it. And consumers are often surprised to learn that, hey, the ingredient list didn't mention sugar, but I now discover it has a lot of sugar in the form of maltose, in the form of sucrose. I mean, sucrose you can guess is related to sugar. But the industry has learned to sweeten products without having to use the word sugar, and that's in part to circumvent the consumer's concern that they may be consuming too much sugar. And then finally, there are the so-called non-nutritive sweeteners, and I say so-called because the sugar alcohols, in fact, have some caloric content. To be sure, it's less than what you would find with conventional carbohydrates, where you have 4 calories per gram. With the sugar alcohols, it's 2.6 calories per gram, but still, there are some calories. And then there are these other non-nutritive sweeteners that we need to talk about because the taste, the sweet taste seems to generate some metabolic consequences. And as we learn more about the physiology of the body's response to sweet taste, we're going to be encountering issues such as there's some evidence that high intake of artificial sweeteners may be associated with increased insulin resistance. And what are the mechanisms to explain that? We don't know, but the gut microbiome, again, may play a role. Stay tuned.